Hi, thanks for coming to look at my poster. My name's Tiffeny James. I'm a PhD student in the UCL Division of Psychiatry, funded by NIHR ARC North Thames. My PhD is about equity in dementia service provision, and today I'm going to present one of my pieces of research, which is a systematic review looking at protection against discrimination in dementia guideline recommendations. So just starting with a bit of background, the number of people living with dementia is expected to increase from 50 million to 132 million by 2050. Dementia really is a global health priority, and another important and related issue in healthcare is around equity. Health equity implies that everyone has a fair opportunity to achieve their full health potential, but some people may be disadvantaged in achieving this. This is often people with protected characteristics. For example, people from minority ethnic groups tend to present later to dementia services than majority populations, meaning access to treatment and care is delayed. For people under the age of 60, diagnosis of dementia takes on average 4.4 years compared to 2.2 years for people over the age of 60. Now, one way to improve the quality and consistency of care in dementia is through clinical practice guidelines. These provide evidence-based recommendations about the most effective approaches to diagnosis, treatment and care. But again, some groups may be disadvantaged if the same approaches are recommended for everyone. And this is what this image here indicates, because it's not enough to give everyone the same thing. People are likely to need services and care that's tailored to their needs in order to achieve the same health outcomes as others. So the aims of this study were first of all to identify which countries have national guidelines for dementia, and then to identify guideline recommendations related to protected characteristics such as age, race or religion. And I use the UK Equality Act as a framework for this. I'll touch briefly on the methods. So this was a systematic review. I searched 3 scientific databases, a guideline-specific database, and to be as inclusive as possible, I searched Google for the phrase dementia guidelines and then individually inserted the name of all 196 countries. I did this search in English and in the official languages of each country, which, as you can imagine, took some time. Now moving on to the results, I identified 44 countries with official guidelines for dementia. 37 out of 44 included at least one recommendation related to protected characteristics, and I rated 18 out of 44 as higher quality. This is all indicated on the map here. In terms of protected characteristics, I identified recommendations for 6 out of 9 protected characteristics, listed on the right here. Just to touch on a few key points, age was the most frequently referenced characteristic, with recommendations that healthcare workers use specialist services to assess and care for people with dementia under 60. Lots of guidelines recommended that healthcare workers consider culture and religion when providing care for dementia, but they didn't really give any examples of how to do this. And out of 44 guidelines, I only found 1 recommendation related to sexual orientation and none related to gender identity. So why does this matter, and what should we do with this information? Well, the World Health Organization say that a key indicator of a country's dementia readiness is whether they have guidelines or not, and we've shown here that only around a fifth of countries do. We're actually going to share our findings with the World Health Organization because we identified an additional 23 countries with guidelines than currently recorded on their database. Countries without guidelines can adapt existing high-quality guidelines that consider protected characteristics, such as those from Australia and Norway. And based on our findings, we recommend that future guidelines consider protected characteristics and include specific related recommendations across all aspects of dementia care, providing examples of how to implement these recommendations. This will help healthcare workers design tailored management strategies based on individual need in order to improve equity in dementia service provision. Thanks very much for listening. This paper has been submitted for review and hopefully will be published in the near future. If you've got any questions about the research, or if you'd like to see a copy of the paper once it's published, then feel free to email me. I've put my email address on the slide there. Also want to say a big thanks to all my co-authors for their input on the paper, especially my supervisors, Jill, Nahid and Andrew. And an extra special thanks to everyone that helped me extract data from guidelines that were not written in English. I couldn't have done it without you, so thank you.